Many vaccine providers are pushing to get vaccines to people in underserved areas, but they might not be the areas that had first come to mind. CBS 17's Bridget Chapman is joining us live after digging deeper into these vaccine deserts here in Raleigh. And Bridget, what were you able to find out today about that?
Well, Rod, when you typically think of a vaccine desert, you might think of a rural area or part of the county, but there are actually a lot where I am right now in East and Southeast Raleigh. I found out why that could be. This map shows the most vulnerable areas to COVID-19, along with the places with the least amount of access to the vaccine. If you narrow in on the worst in each category, clusters mainly pop up in East and Southeast Raleigh. And one of them is Joseph's Pharmacy on New Bern Avenue.
It's not surprising.
Pharmacy manager Jonathan Harward says a lot of people who live nearby don't have access to internet or transportation to get their shot. He says their first surge of vaccine patients weren't pharmacy regulars.
Here in the last few weeks, it has kind of tapered off a little bit.
Staff allows people to schedule on the phone or walk in, unlike some other pharmacies. They vaccinate up to 100 people a day, but now the faces in their seats are more familiar ones.
This is my pharmacy. I always come here for my medicine and everything.
Sandra Hunter waited to get her vaccine until she saw how others reacted.
Girl, done.
Oh, for real?
Yeah, girl.
Give me a Band-Aid.
She brought a friend to her appointment who ended up getting his on the spot.
But he's getting a shot too. Because you're around me, you're going to get a shot. How about that?
Other patients said they held off on the vaccine to beat the lines.
I just waiting to get a shot, not waiting for anyone at all.
Health experts say it's now a matter of making sure people know they can get their shot while making it as accessible as possible.
If you can get it, let's get it and let's get through this thing.
Let's get through this thing. That's what we all want to do. Now, the manager also told me they're really cautious right now of not wasting any doses. So he does hope that supply can get to the point where if someone walks in for a vaccine, they can open a vial to give them a dose and not have to worry about wasting any other doses for people who may not show up for them. Reporting live in Raleigh, Bridget Chapman, CBS 17 News.
Well, truer words have been spoken. Let's just get through it. Bridget, thanks. We appreciate it.